Okay, we are live. If everybody wants to get ready to rock and roll here, I will turn this over to Sam and Aaron, and they can take it from here.
I'm Sam, and this is the first time we've been on. How long's it been now?
Over a month.
Several weeks.
At least a month. And it kind of plays into tonight's episode. We also have Aaron, if you'd like to introduce Emily. We don't see her very often.
Emily with us, and we have Tara with us. And I think you're going to introduce our other guest, who you do see on the screen there.
Yes, we have Bailey Phelps tonight from Ohio County Healthcare, and she is, first of all, we thank you for joining us tonight to field some questions and to talk about what's going on out there. It's been a very eventful day, for one thing. Announcements earlier, but you work with Ohio County Healthcare, and for those that don't know, I mean, kind of explain a little bit about what you do if they don't already know.
Yeah, so I'm an internal medicine physician, and I've been at Ohio County Healthcare for almost 5 years now. Um, Pretty much 90% of my practice is outpatient, so I see patients in the clinic, but also do a hospitalist rotation where I take care of inpatients as well. And I'm the medical director at Signature Healthcare of Hartford, and I also sit on the COVID emergency response team that our hospital created when all this started.
Okay, so we know, and everybody knows this, not only just us, but we have rising cases all over the country. It's now over 1 million were reported last week. That's in the entire United States. And in Kentucky, we've had days of 2,000, and then we did finally hit over 3,000, I believe, last week. Today we had well over 2,700. Again, very high. We had 33 deaths yesterday, which was the highest death total we've had in the state so far, and we had 15 today. Um, and again, these cases, I think, and Dr. Phelps, go back probably to Halloween and Election Day. I'd say is what we're saying. What we're seeing now, where this growth is.
Yeah, I mean, I think for a long time, all of us can remember where we were looking at the numbers and, waiting for Ohio County to get its first case. And we may only have, one or two cases every few days or a week. And truthfully, as time has gone on, I think a lot of us are kind of tired of COVID, and rightly so, and it's getting pretty monotonous. But with that comes complacency, and with that kind of comes lax in attitudes and a lot of the things that we recommend as a medical society. And, I think now what we saw in New York when it all first started is now what we're seeing in Kentucky, but in the Midwest in general is where the cases are rising.
And they warned us a while back that this was going to be, a really tough time in the winter. And, we're hearing different cases of people that they didn't think it was going to happen to them. What about the difference in severity? Because everybody is different. But what are you seeing?
Yeah, I mean, I think so. We definitely have the traditional symptoms, So back when everything started, we kind of had those the symptoms of the cough and the shortness of air and the fever and all the respiratory stuff, and we definitely see that. And that's the type of COVID symptoms that I think everybody fears the most, because that's what ends up people in the hospital and on oxygen. And we talk about scary things like ventilators and those types of things, but we also see a lot of the GI symptoms or gastrointestinal, when people, they can't taste or smell. So they have zero appetite and they don't eat and drink and they get dehydrated. Extreme fatigue and headaches are another one too, where people are just completely wiped out and they, don't move and they get weak. And especially in populations, with our elderly patients, that's a big deal. It doesn't take very many days in a row for that to make a really big impact on just their prognosis in general. And there's the lucky few, of course, that have minimal symptoms, and it doesn't really affect them very much at all. And that's great, for people that fall into that category. But obviously, we worry about the other two.
For so long, is I know that a lot of us personally here with me in local that are involved. We've had instances, if not personally, family members that unfortunately tested positive, cause some of us to worry, get tested, maybe self-isolate, do whatever we need to make sure that we're safe and to keep the rest of our family safe. So fortunately, in my family, the ones that did test positive, they've all been very mild cases, like you just expressed. I know others haven't been so lucky, and we have had some deaths here, unfortunately, locally in Ohio County. And one of the things that I keep coming back to, in fact, I was having a conversation with someone the other day, and they said they just feel lied to because when all this started, they were said, "Oh, this is such a deadly disease," and most people are just getting over it. And from the outset, my understanding has kind of more been, yes, it's deadly for those who have a bad reaction, but the primary concern was maybe the overflow that our hospitals and healthcare providers wouldn't be able to take care of. So obviously, Ohio County Hospital is a very small hospital. We're very fortunate to have a hospital here, right here in Ohio County. There's no bigger community we are, but we're small. How equipped are we here locally to deal with a company?
Yeah, and I mean, I think right now, truthfully, is kind of that situation where we have had all these meetings and put all of these emergency responses in place to deal with the moment that we're in. You know, the things that we're seeing is now that the cases are rising, you know, what we would say are our bigger hospitals in our region, you know, like Owensboro specifically, because it's the one that's so close, you know, their beds are full. And so we don't have that reassurance that if we have a critical patient that comes into the ER, that we can just transfer them to, you know, a bigger hospital that has, you know, more COVID beds and pulmonary critical care physicians. And so, you know, we have been forced to make sure that we can take care of these the sicker people at our hospital. So, you know, all of us physicians, you know, we had training, or not necessarily training, but refresher courses in critical care that I led along with the other few of the physicians at the beginning of all of this. We've expanded our rooms. We've made sure that, you know, we have the appropriate treatments medication-wise that are currently recommended that we can get at our facility. And, you know, we can treat these people here. And we do have that reassurance on the back end that if people worsen and we do feel like there are other care that's appropriate for people, that we can transfer them to other places. But that can't be our first thought always, just to be able to send people elsewhere, because it's becoming not 100% an option every time.
What care can you give them at least? And at what point do you send every single person to Owensboro?
No, not at all.
No. Okay.
Yeah. So, I mean, with COVID in general, really the respiratory symptoms with COVID is what we worry about that could progress where they may need other care that we can't provide. So with GI related issues, with dehydration, I mean, all of that, obviously we can take care of here. Mm-hmm. Initial treatments with COVID, you know, truthfully is one of the antivirals that is out. You can give, and it's recommended to give steroids orally, and then also respiratory nebulized steroids now. There are a couple other things that are out as well, like antibody treatments that bigger facilities are getting, but who gets those treatments is very specific as far as criteria that they have to meet. And so obviously, if we have somebody that needs those treatments that we can't give, then we send them. But if we can treat them with kind of the first stage of what's recommended, and obviously they're improving and they're getting better, then that's things that we can handle at our facility.
Well, I go to one of my questions, and concerns for like maybe not having enough PPE and or protecting the rest of the hospital staff, and or having enough, I guess, resources available to carry on other medical needs, such as other outpatient surgery, just general care, rehab. What are you seeing now in Ohio County? Is that worry still there, or treating it and managing it better?
No, we've been managing okay. So that's something still on a you know, day by day or weekly basis we still track, and you know, we have one of our managers that keeps track of all that. But as far as you know, our gloves, masks, gowns, you know, we're good on those things, and you know, our materials management are are always truthfully, looking at other places that we can get materials if we feel like we're getting low. But fortunately, we've been okay this whole time.
The governor spoke today, and he has to provide some hope. I feel that he was trying to, but he was talking about possibly seeing a light. I mean, is that something too soon to call, or so since we're so far, this is like the third wave right now.
Yeah, I mean, I think that's hard. I mean, there's definitely going to be an end, and obviously, I'm going to 100%, think that there's always hope, and there's going to be at the light at the end of the tunnel. But I mean, we're very much in this region, at the worst it's been this whole time. So I think it's a little bit naive for us to be able to say, in a few weeks it's all going to be better, or we're estimated to be, this number of cases at that point. I think. We tried to flatten the curve, initially, and we heard that a lot. And truthfully, that was kind of to do things like Tara was talking about, where hospitals could plan and get resources available and prepare for the surge. And the surge is here now, and now we have to deal with it. But and until we really clamp down and follow the guidelines that have been recommended, this entire time, and then hope that we have a vaccine and that people take the vaccine. And, that's when we're going to have long-term improvements in regards to just the COVID pandemic in general.
What did you think of today's guidelines? Oh, sorry.
Today's guidelines in regards to the governor.
Mm-hmm.
Like, what do you? I mean, I think we all knew it was coming.
Right.
My opinion in general is that, I mean, anything that we can do to limit contact with people that aren't in our small circle should be done. But truthfully, again, if it doesn't matter how many times we shut down school, it doesn't matter how many times we shut down restaurants and all that. If people don't put a mask on, and if they don't limit their interaction with other people, we're still going to spread the cases. So we have to take responsibility on ourselves, even though it stinks. And this is a terrible time of the year to socially isolate, because myself included, I want to have Thanksgiving with my extended family, and I really don't want to have to cancel Christmas. But the reality of it is we are probably going to have to. But we're making decisions now and hard choices to hopefully make sure this is not the case next year. As far as like when we give the vaccine, or how,
like when will it mobilize to Kentucky? I mean, I guess you can look at that and say that mobilization of this.
So I think initially when the vaccine comes out, it will go to high-risk populations first.
Right.
So, initially it's going to go to healthcare workers. It's going to go to long-term care facilities. It's going to get the people that are at most risk. And that's a lot of people. That's not just, a small number. So, realistically, it just depends on how many vaccines are able to, to release at once. I'm sure all of us can agree that, Ohio County, Kentucky is probably not first on their list when it comes to, people they want to get it first. So I have a feeling that will be kind of down the road in regards to non-important personnel, if that makes sense.
Right. Mm-hmm.
So
I think it'll take months in order to vaccinate everybody.
Well, I think that was kind of one of the things too. I've noticed various discussions on social media and at work and other places too. And they're like, well, a vaccine's coming. We can get back to normal soon. And I think it's important that people remember that, number one, it's going to take a long time to get everyone vaccinated in this country. Yep. And number two, there's a latency period for vaccines. It's my understanding. So just because you get a vaccine today doesn't mean tomorrow you're immune. Plus, there's only that you may be part of that 5 or 10% chance they're seeing isn't effective.
Right.
So, what's your recommendation for the population? Like, I think Dr. Fauci said that, hey, we're still going to have to maybe wear masks and still kind of be careful in our social interactions, even after the vaccine is more widespread. Is that your professional opinion as well?
Yeah, I mean, because like you said, it could take months to vaccinate everybody, and so it will still definitely be the recommendation that we follow, follow the same guidelines now until we have mass, populations vaccinated. And I mean, in one general rule is, until you have over 80% of the population vaccinated, you don't truly have herd immunity. And so until we really have that, we can't really say that we're going to, improve things. So it's going to be a while. Most vaccines, even the flu, for instance, it takes a few weeks to consider yourself immune to what you're being vaccinated against. So you kind of have to tag that time on to whenever the tail end of people have actually been fully vaccinated.
That we actually just had come up on our Facebook Live is, if the majority of citizens follow the recommendations and wore masks, if they socially distanced, avoided gatherings, what kind of impact do you think that would actually have? I know you mentioned that we're going to have to do this, but how quick do you think we'd see the impact?
I mean, I think decently quick in a couple weeks. I mean, based on exposure rates, they typically, if a group is exposed, it's usually within a week or two that we see the spike. So in the similar stance, if we decrease the exposure, it's going to take at least a couple weeks to kind of see it go down. But we are very much, we like to have that immediate gratification, and so it stinks to be patient, but that's what it would take for sure.
Especially Thanksgiving coming up, and that's going to be the hardest one, and that's been the main thing that they've been talking lately. But not only do we have this, we've experienced Halloween. We have 2 more events after this that encourage gatherings traditionally, which will be Christmas and even New Year. I guess some are hoping that as soon as the ball drops on New Year's Eve that this is all going to go away. It's obviously not. But do you think Thanksgiving will be the trickiest of them all, or?
No, I mean, I think Thanksgiving and Christmas are equally going to be bad. I mean, truthfully, I don't know how, even everybody in this group is, but, we get together with bigger groups with Christmas than we do Thanksgiving.
Right.
And I know that's different with every family, obviously, but I think those will both equally have bad impacts. And I can almost, guarantee that numbers will continue to rise or just stay this bad if we don't, kind of try to stick with more our immediate family, or again, the people you're already around. I'm around my parents because they watch my kids, and that's still considered kind of in my immediate bubble, and those are the people that we have to stay around to try to not continue to spread.
Yeah, we've heard a lot from our viewers as far as some of their plans and how they're having to kind of shift this year. So, I know for my family, we don't have a large extended family that lives close to us. Most of my aunts, uncles, cousins live in different states or different parts of the country. So it's usually just our close family. And so it's not going to affect our plans very much. We're already, same with you. I mean, my parents and my in-laws both watch my son. So we're already in our bubble. We're already going back and forth. So, we don't have to shift, but I know it is not the case for a lot of family. I know we had one viewer that said they normally have a large group that gets together, and they were hoping to have their Thanksgiving outside this year. But just with the cases going up and the uncertainties of the weather, obviously that's not going to be doable. But she talked about making plates for everybody and dropping them off on the doorstep of her family members. So I thought that was a really great idea. And I know other people are trying to think of creative ways to still get together and still be with family, even when we can't do it the way we've always done it. But I think this is kind of the time to think outside the box. And even if it's you say, okay, maybe we can have Thanksgiving in April or March. I don't know. Who says Thanksgiving has to be in November? I know for people like the Westerfield Phelps family, harvest is a big deal. So it is a celebration of harvest, but I don't harvest anything, so I can have Thanksgiving whenever I want it.
And I love that idea too, right?
Yeah, I mean, the Masters was in November, so why can't Thanksgiving be in April? I like it.
Save for a time we can be really grateful, like if we come to the end of this, or at least it gets better.
Exactly.
Because
Really
we're
creative way to, yeah, it was creative though. I thought to say, oh, I'm going to make meals and I'm going to take it. Here's like maybe I'm making dessert. I take it to the family, and maybe this other person makes a salad or something. You kind of have a rotating. I mean, the idea behind Thanksgiving is not necessarily all coming together at the same table, right? Like, Lord knows we all eat too much as it is in our family, but we could certainly, just kind of enjoy the idea of maybe giving something to each other and still having that camaraderie without necessarily being there in person. So I thought that was a really creative way to approach the holiday. I know Christmas is probably going to be the biggest one. Like Dr. Phelps said, with our family, is we always usually have a huge group, multiple groups. We have our friends, we have separate families, we have my in-laws and my family and my extended family. And I say extended family, like most people call it extended family. That's my immediate family, because we're so close together. It's just going to be very difficult to downsize that this year. But at the same time, I don't know that I could deal with the ramifications if I found out when we got together and then one of them got sick. I think that would just be absolutely spooky. And I think that's one of the decisions that we have to make personally.
One thing, and we'll provide a link and a picture of this, is this COVID-19 assessment tool that Georgia Tech University has worked on. Now, if you go to it, the baseline, and it gives you a number. It gives you, I think the group gathering number starts at 10, which I think is a little unfair. But the baseline is what you look at when you go to the site is 50 people. And then you can move it however you want. And when I moved 10, a group of 10, and then you can zoom in and focus on each county in the United States. It's very impressive. Then it said it was and again, it's a rolling, the numbers could change every day on this chart. And that's what's great too. It said that Ohio County had a 19% chance that somebody could get infected. And that was, again, that's today. That's not a week from now, but still it's low. But again, we want to be very safe.
Yeah, and if you look at that too, the surrounding counties are even higher. I think McLean and a couple other places. But even when you think about it, I mean, having 10 people with an essentially 20% chance is what they're estimating to be contractivity. I mean, to me that's still pretty high. I mean, and like you said, you put it up to 25, and which is what the current venue guidelines are for things. And I mean, I think the rate goes up to almost 50%. So I mean, they're not good numbers. I think that's just another way for us to just say, like, truthfully, the more people you expand your bubble to, the more likely you're going to give it to somebody or somebody's going to give it to you. And unfortunately right now, it's not just the quote unquote unhealthy people that get sick from COVID. Even the healthy folks can have complications, and a lot of the people, the most likely age groups right now that are getting infected, are those 20 somethings to 50, and the 20 to 29 range is where we're seeing a lot of it. So I think most of the time we would consider that age range on people to be healthy and not likely to have complications, and that's not always the case.
That's one of the arguments. Oh, sorry.
No, I was just going to say we have another question from a viewer.
Okay, go ahead. Yeah.
From day one, people have argued that the numbers are inaccurate. Do you notice a discrepancy between the numbers that you're seeing as a doctor here in Ohio County versus what we're hearing the health department report and what's projected for our area?
No, not. I mean, I think in the beginning, it was hard to kind of grasp the numbers because we kind of, like they were saying, we were seeing all these huge numbers up north and how bad COVID was, and it was terrifying, and it's almost like we were waiting for it to come to Kentucky and it was going to be bad, and it took us a month to even get a case. But now, I mean, I don't have a single day in clinic that I don't have a patient of mine personally that calls saying them or their family or somebody was diagnosed with COVID. For the past few weeks, I don't think I've had a single day that I haven't had a patient admitted with COVID. I've had family members with it, family members with complications. So it's it's very prevalent right now. We have employees that are getting it now, where we would have months that would go by without a single person, within our corporation to get it. So you can definitely tell, just even based on my practice, that the numbers have skyrocketed.
I'd seen one of the arguments that a couple of people have. This is jumping back to the Thanksgiving one. Is kind of like, hey, this might be the last time you get to see grandma or something like that. Don't hold off on Thanksgiving, and you should go out and live. I mean, what's your kind of reaction to that? I think I know what it is, but
yeah, I mean, I'm hugely empathetic about that, very much so. But I think that me personally, not even a physician, I can live with myself a lot more if I didn't spend my last Thanksgiving with my grandparent, or rather than me giving my grandparent a virus that led to their death. That's not something I would be able to live with very well. But it just goes back to trying to protect your family. There are other ways to spend time with your loved ones that don't require to sit in a room. You can call and talk to people. If you have a savvy grandparent, you can do FaceTime, but it doesn't have to be in a room. And I think that's what our family's going to have to do. And it stinks, but it is what it is.
I think that brings up an interesting topic is, we all talk about COVID, and like you said a minute ago, we're seeing a highest number of cases in people in their 20s and early 30s. But I think the biggest risk that we're seeing is, we don't want grandma and grandpa to get this, because the elderly are seeing probably a more prevalent death rate, unfortunately, complication rate. But again, I heard you and Emily both say, your parents watch your children, and that they're grandparents, and they may be younger than what our grandparents are. My grandparents are 70s and 80s, and I know both your parents, they're not that old. But I mean, at the same time, that doesn't mean they're not at risk too. But kind of getting back to the fact is, Governor Beshear mandated closure of all schools, especially elementary schools in Redstone, as of right now, effective Monday. So my question, because we've had so many comments from parents just worried about sending their kids to school, and is it safe, and are their kids okay? We're not seeing a lot of cases in the schools, but we're also hearing that kids are asymptomatic. So what's that risk there? How does that play into say, hey, if the kids are being watched by grandparents? Because obviously that's needed, because parents are working. In Ohio County, a lot of our grandparents are raising school-age children. Right? That's just kind of a common thing, unfortunately, these days. So, what's the risk there? And as a physician, are you seeing a lot of these asymptomatic carriers resulting in more cases in the hospital since school started?
Well, and truthfully, because I don't see kids, so my, patient population is pretty much, 16-year-old and up. So specific to, younger kids, I haven't necessarily seen any of those. And the providers that we have in our building, I haven't necessarily had conversations with them that they're seeing that. You're completely right. I mean, the rates of infections in kids is extraordinarily low compared to adults. It still happens. Their symptoms, thank the Lord, are typically, minor. I think this would be a completely different nightmare if we had children dying left and right from this. But they still can transmit it to adults. So I've had a few grandparents that have gotten COVID that got it from their grandkid. So it definitely happens, and kind of, like you said, all the more reason that just because your kid may be lower risk of having a complication from COVID, they still shouldn't be out and about around a lot of other people, because they can still bring it home. So you still have to think about those people, 2 or 3 down the line that are in close contact with your family.
Yeah, I think when we think about schools, obviously, like Tara said, the recommendation that came out today, and then of course we got a phone call from Superintendent Seth Southard this afternoon that, we will be going to remote school starting on Monday for those that were in-person classes. there's just so much to think about there. Of course, I've worked in Ohio County schools for several years and worked very close with a lot of the families and students there. And in our county, we have such a high population of people who live in far rural areas. Internet is hard to come by. And I know there's been a lot of people since the pandemic started, from legislators to some of our electric companies and our communications companies, trying to think of ways to provide internet to those far rural areas. Unfortunately, there's still a lot of areas that don't have it. It's not accessible. And then again, you have, like we said, grandparents raising children, which sometimes can also create a disconnect there with technology. When you have an older generation, I know just there's a huge disconnect between me and my 7-year-old. He can get on any device and do anything. And I'm like, wait a second, this wasn't even invented until I was a grown up. So give me a minute to think about it. Our teachers and our educators here in Ohio County and across, the nation and the world are doing an amazing job of having to adapt and come up with different ways to educate, to learn, to reach out to their students. Dr. Phelps, tell us a little bit about just kind of how you feel as far as the effects of all of that, whether it's, we know there's a double-edged sword. Yes, as far as COVID is concerned, there's a lot of cases we've got to stay home, but then there's also the other side of it as far as our children, their mental health, our kids that are in food insecure homes and things like that. I mean, is it just one of those things we're kind of having to figure out how to fight the battle that we have in front of us?
And not just children either. I mean, it's hard enough to be home as an adult and to isolate as an adult without social interaction.
Yeah, 100%. I mean, I think all of this has been a huge negative for education. I mean, truthfully, there are a lot of people that can deal with this, but there are a lot of kids and adults that do not learn the way that we're forcing them to learn. So I think it's a huge negative. I don't have any kids in school, but my daughter is in preschool, and honestly, it kind of breaks my heart that she's not going to be able to just experience preschool. And I know that in 10 years from now, it's not going to matter, but it still stinks. But I think socialization is so important for kids, and we're taking that away from them. Socialization is very important for adults. I probably have seen more mental health issues, in the past 6 months than I have previous. And I see a lot of mental health, but a lot of people are really struggling because, they have their children telling them they can't see their grandkids, and, they aren't being able to go to, the very few outings that they were normally able to go to. And so people are depressed and they're anxious, and that leads to us kind of throwing our hands in the air and just saying, forget it, I'm going to do what I want to do. And I get all that. I mean, I think we've all had those moments where we're just tired, and it stinks. But I think it's bad for the education of our kids. I think we're going to spend the next couple of years probably trying to catch up on what we've lost.
We know now about sports too. Today. We know that basketball will not start until the new year on January 4th, and they're going to try and just do a shortened season. There was a mention of extending it into May even, but now, and I think they said this is what the board was discussing, that practice was, I think, did the governor say suspend practice? He probably had some sort of, okay.
Indoor.
Okay. I just wasn't sure. I think that was leave it up to the school issue, but games definitely not starting until January.
And I'll jump in quick. I was just going to say, if anybody's got any more comments, if they post those to the live that we have, we'll get to those as we kind of wrap up here with Dr. Phelps. But sorry, go ahead.
No, I was just going to say, I mean, I think one of the frustrating things for me, and I would almost certainly say with everybody else, is just the inconsistency with a lot of the recommendations. I've done sports my entire life, and I'm very pro athletics, huge sports fan, but to me, we haven't been consistent about what we recommend in our schools versus what we recommend in our social aspect, what we recommend in our sports. And I think that's been frustrating. So, I mean, I think one of the positive things about today is that we're finally on the same page, that it doesn't matter, what we decide to do, that we need to do it in all areas of our life. And I hate that it took a surge for that to happen. But, professionally, we shouldn't have been practicing and having sports to begin with. And I know that stinks. And if my kid was in high school and they were a senior, I would have gut-wrenching problems with that. I truthfully would, but we can't pick and choose what things we're going to comply with. So I'm at least glad that we're doing it all on the aspect, and kind of to go back what Tara was saying a little bit, I think the more areas of our life that we actually follow that on, the quicker we're going to notice the decreases in numbers. And so maybe this is what it takes.
Interesting that just popped up. It is my sister. She's the one who's actually watching it. And I know Bailey. Sorry, Dr. Phelps. I know her as Bailey. She spent the night at our house with my sister. Meredith Thomas, she goes, as a teacher, it is incredibly difficult for teachers, students, parents, and knowing that we aren't educating our students and getting them academically where they need to be is heartbreaking. That said, our number one priority is and always has been the safety of our students. And so I agree that going remote is an unfortunate but necessary step. And I have, from the day that they've gone remote, she has always been like, this is so much more difficult than just even virtual or preparing, because she was just doing everything. But yeah, I think that's what I'm hearing from family, my friends, other teachers, is they want to be in the classroom with these kids. They miss these kids, and it's hard on the teachers. It's hard on the children, but I think the majority of them are realizing these sacrifices are necessary.
And I think
that's
sometimes,
perfectly worded.
And I think sometimes we forget how resilient our kids are. They've had a lot taken away from them over the past year, but especially the young ones, it'll maybe be a faint memory, depending on how the world is when we move forward finally. But our kids bounce back. I think sometimes the adults have a bigger problem than the kids do with some of the stuff that we're missing. They're so creative, and they think of ways to celebrate and to do things. And if we can't go trick-or-treating, we'll have a Halloween party, even if it's just at our house with our family, and throw candy in the air and act silly. Whatever it is, and everybody has to kind of make decisions that's right for them. But it's our kids they're resilient, and they're going to make it through this. And I think the more we can model some of those things, and doing what we can and trying to do the right thing, and trying to help get us all on the other side of this. I don't think there's one person that will say, I love wearing a mask. I know in the beginning, everyone joked about liking social distancing, introverts, this is my dream to stay at home in bed and watch Netflix all day. It's not my dream, because I'm not an introvert. So that was hard for me. But
yeah, self-employed person, that hurts. Like, it's painful to not be working. Yeah.
Right. Well, and I mean, at my job at the airport, when air travel shut down for 6 straight weeks, I sat a lot of days at my desk by myself. It was hard, but we made it through. And the more we can do to help each other make it through, the better.
One to like you commented there, Emily, too, is we've heard so much. It was like, oh, I'm so thankful that something's happening for the children, or our kids need to be in school, or how am I supposed to work, and our kids need interaction. This is good for them. And I do think that sometimes we talk so much about the resiliency of children, but then as they grow up and they do, they become adults, and some of those maybe exhibit bad behaviors, and we say, oh, well, these are childhood traumas. So I do think that they take in more than we're giving them credit for. And I'm sure that this is kids, but we're getting comments from parents that it's, they're happy that the governor went ahead and closed down the schools, just because, it's nerve-wracking to be a parent. This morning my dog accidentally turned on our stove, and we're thinking, golly, what if we had a live child in our house? So we should handle the dog. So I think that's where we're at, is you're hearing a lot of people be very vocal about how they want the kids back in school. They want to just go out and they want to do things. They want to go trick-or-treating. They want to go to the parades. They want to go to these festivals. But I think there's also a large section of our population who they don't want to necessarily have to say no, when everybody else is doing it, when your kid's best friend is saying, let's go, and you're having to be the bad parent and say, no, it's not safe. So sometimes some of these mandated things in a way are good for these parents just to have a little bit of that stress relief and just say, no, we can't because they had to close it. Here's why. Maybe takes a little bit of that burden off them. But that's my kind of takeaway from it. Not a parent, but yeah. So that is good.
No, you're right. It is easier on parents when we can blame it on somebody else.
So, but I think that begs the question too. And again, I think I know Dr. Phelps' answer based upon the rest of this, but we do have things in our community that are scheduled to happen. I think there's so far right now a Christmas parade and festival coming up in Beaver Dam. There was the trick or treating not too long ago. People are getting together for the holidays. They're expressing the wants to go out and do more, go to ball games and stuff like that. So, as a bright line rule, what is it? What do we tell people?
I don't think we should do it. Again, I think that it's completely normal for all of us to want to do those things and to continue to want to do those things. But if people want to be able to go back to life as a more normal thing, then you have to sacrifice those things in order to get there. And again, you can't just pick and choose. It can't be, I'm going to wear my mask to Walmart, but I'm going to go to my Thanksgiving with 25 people. You have to do it all. And again, I don't want to have to decide to cancel our Thanksgiving plans probably tonight, but it's probably going to happen. And like you said, Tara, I don't, in good conscience, I can't not do it. And it stinks. It's okay to be upset about it. It's okay to be angry about it. It's okay to blame your doctor or blame the governor about these things, but it still is the right thing to do.
I think that's the best way it's been put, because I've watched the governor not every day, but I don't think anybody's really put it like that. Like, we're to get past this, we're going to have to do this now. This is the sacrifice we have to make so we don't have this in the future. If everything was ideal, and maybe if we had taken this, if everybody had taken it a bit more seriously, we might not have been this severe right now. We might not be looking at half a ball season or, having only immediate family at Thanksgiving. I mean, we're not coming out and blaming anybody, but
Right.
hey,
But I've really enjoyed this discussion. I think it's answered a lot of questions. It's basically, it's a lot of us knew the answers to some of these questions that we posed, but I think it is nice to actually hear somebody that is well versed and on the front lines, seeing this every day, to say, listen, it is serious. So I do appreciate that, and for you taking your time out to come.
Yes, we want to thank Dr. Bailey Phelps from Ohio County Hospital, and we want to thank all of our healthcare workers, all of our teachers, our educators, volunteers who are helping during this entire process, because we could not do it without any of you or anyone that's seeing this right now.
I'll add, we appreciate the people that are masking up, and even if they don't want to, it's taking everybody. It's every little bit, and it's every person. And I think some people are taking it more seriously now than they did before, because now they're seeing it's hitting closer to home, and they do know that person that is sick or, unfortunately passed, or whatever it is. So we're more aware. People are more aware now, I think.
Yeah, thank you to everyone who wears a mask and wears it properly. Please cover your nose.
Yeah.
I mean, they are connected, right, Dr. Phelps? The nose?
Yes.
Okay. We all go to the same place. Just making sure. But thank you very much.
Yes. Thank you guys for having me too. I appreciate it.
If you haven't, if you tuned in, if this has happened to be your first episode, actually, I really like tonight's format. Maybe we can do this again. I don't think any of us are getting together in the same room anytime soon. But this has been good. But make sure you like and subscribe to Maine and Local. Share it if you don't mind. Send us comments. We're always happy to hear other topics Any issues that you'd like to see come up in maybe future episodes that we can address. That's kind of what this is for. It's Maine and local. So right here in the OC, we wouldn't be able to chat about what's important to y'all. But thanks.
And
Thanks.
we'll have this on the Facebook page. If somebody happened to miss it, we'll have that saved. So we thank you all for tuning in. Thanks very much.
Have a good night.